Hi, hello, good evening everyone. Today I am going to present regarding physiotherapy management in PIP joint ankylosis, a case report on toe-to finger joint transfer rehabilitation. So before starting the topic, myself, Dr. Surya Sai Akhil, PhD scholar from Mother University, and also I'm thankful to INTI International University for organizing this wonderful conference, and also I'm thankful to my dean Arunachalam sir, who is my co-supervisor as well as my guide, Dr. Vaibhav sir. I'm thankful to both of you. So before starting the presentation, it's about the case study or a case report on toe-to finger joint transfer rehabilitation. So coming to the introduction, why this case matters. This case matters because usually ankylosis is common for the most of the joints, but when it comes to the PIP joint, it's quite challenging because you cannot perform any kind of functional activity with your hand where you have to gripping the objects, or especially for the IT employees like this. In this case, this is an IT professional guy where he has to do daily life activities with his hand activity, where it is completely significantly problematic and facing functional challenges to complete his task on time. So this is unique case because the severity and the severity and the chronic stage of that ankylosis demands for the surgery to the replacement of the joint. So we did the conventional rehabilitation for this joint, and the contribution of literature was be done by the care guidelines. So coming to the history of the patient, is 35 years old IT professional guy, and he is having severe stiffness and pain in the right middle index finger of the PIP joint. So medical history was the status was post toe to finger vascularized joint transfer to the middle and index finger of the right hand. So we didn't get any original injury, surgery specified, implant complexity, no details of this all things. Okay. So prior treatment was patient reported limited success with previous conservative interventions for stiffness. Occupational impact also will be maybe maintain prolonged typing, difficulty gripping objects, reduced dexterity, severely affecting professional performance and daily life activities. So clinical presentation, it persists joint dysfunction, and there is a functional limitation where IT task couldn't perform the mouse control, fine motor activities, basic activities was unable to perform, like difficulty to perform. Unique challenges like because the combination of chronic ankylosis and post-transfer, the high functional demands of the IT profession made this case particularly challenging. So standard rehabilitation protocols fall often addressing such specific high-level functional restoration needs. So we motivated and engaged the patient. Full occupation function was key factor, and we leveraged through objective feedback. So initial assessment beyond the standards, like our assessment went beyond the qualitative observations, emphasizing precise quantifiable data collection, RVM of the goniometer using the daily meticulous measurements of active and passive PIP joint flexion and extension, providing the granular data on joint mobility. The frequent measurements allowed for immediate therapeutic adjustments. Using hand dynamometer employed for the regular objective assessment of grip strength, this tool was provided a clear, measurable benchmark for strength progression, directly correlating with the functional improvement. Coming to the functional task, the IT specific tasks like typing speed, accuracy, mouse dexterity, so established baseline functions which guided targeted interventions. So pain assessment was visual analog scale used to track the subjective pain levels. So coming to the treatment objectives, the primary objectives was restore the full functional range ROM of the PIP joint and rebuild the strength in pre-injury and post-professional standards, eliminate pain and discomfort during functional activities. So coming to the secondary objectives, we implement ergonomic corrections for workstation and typing techniques, and preventing the stiffness and pain reoccurrence, as well as the overall hand dexterity and fine motor activities for IT tasks. Empower the patients through self-management strategies. Coming to the innovative rehabilitation protocol, evidence-based intervention strategy combined established physiotherapy techniques with unique emphasis on precise or precision measurements and patient feedback. We also went with multimodal therapy, where techniques used tailored to address the multifaceted nature of the PAP joint ankylosis. So dynamic progression, the protocol was not static, dynamically adapted based on the daily objective measurements and patient response, optimally progression and preventing plateaus. So patient-centered approach was actively involved in the understanding his progression through data, fostering his high adherence and motivation. Coming to the intervention, phase 1, we divided into phase 1 and phase 2. Phase 1 was the pain and mobility restoration, joint mobilization techniques, where we used guided by the ROM goniometer, precise daily application for grade 1 to grade 2 mobilization, gently restore joint plane, reduce stiffness, then again progression to the grade 3, grade 4 as tolerated by reading of the goniometer. So, as well as specific targeting the mobilization specific focused on the PIP joint capsule and surrounded soft tissue to address adhesions and restrictions. Coming to the pain management, we used cryotherapy and gentle active ROM exercises, pain-free limits, promote circulation and maintain newly gained mobility and soft tissue mobilization around the joint to improve the tissue extensibility. Coming to the intervention 2, phase 2, we use strength and function. Progressive strength training was done by the hand dynamometer calibrated with resistance exercises like putty exercises, finger lander exercise, pinch grip exercises, and daily dynamometer. So we loading based on daily dynamometer readings ensured appropriate challenge and measurable gains. Functional gripping exercises, integrated exercises, making occupational demands. So multimodal therapy using go bands for the sustained stretch to the joint and applied edema control. Neuromuscular education to improve motor control and coordination of the hand and fingers. And ergonomic awareness to the initial discussion and minor adjustments to workstation setup. So quantified outcomes, the data speaks about the objective measurement validations, pre versus post comparison, which was 6 weeks of protocol. So after the surgery immediately, we have taken the dramatic transformation of the patient function as well as the pain levels, as same with the post comparison. So patient reported outcomes was the subjective improvements in pain, functional ability, strongly correlated with the objective measurements. So key results was the strength, index finger. As we can see the results, like index finger is improved 80 degrees to 105 degrees and middle finger 85 to 120 degrees, and the grip was the 5 kg to the 15 kgs, which was 200%. As the same with the extension, pain and extension lag, extension was completely recovered, pain was moderate to severe previously, after that it was minimal, very minimal, negligible. And coming to the discussion of this case, so real-time data integration, data objective measurements with ROM goniometer and hand dynamometer directly informed and adjusted therapeutic interventions, and patient was behaved as a partner with us, so that progress was data empowered the patient, significantly boosting his motivation and adherence to the rigorous home exercises program. So loop crucial for complex long-term rehabilitation, targeted the functional recovery every time. It was not generic. It specifically addressed high demand for fine motor skills required for his IT profession, include detailed ergonomic analysis and correction. So rapid and significant recovery was profound functional gains, 200% strength, and 6 weeks of chronic condition post-transfer highlights the efficacy of this precision-driven patient-centric model. So addressing the occupational context, patient psychological engagement was critical as a physical intervention. Conclusion, key findings were structured, measurement-driven rehabilitation protocols, particularly those integrated objective tools like goniometer, hand dynamometer, and superior clinical outcome in complex hand conditions like PAP joint ankylosis. Implications of practice advocates the incorporation of objective measurement tools as dynamic feedback mechanism in clinical practice, not just the baseline. Future research was warranted to validate the precision approach in the larger cohorts and across various complex hand injuries, potentially leads to the new best practice in rehabilitation. And patient-centered care, patient under the engagement through quantifiable progress, powerful motivator, cornerstone of successful long-term recovery. And these are the references and the acknowledgements which we take from the patient, and we are very thankful to our Mr. Chaitanya, who actively participated through this rehabilitation process, and we have taken the consent form for the case data for academic and presentation purpose only. Thank you so much.